Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. This is the podcast where we teach compassionate communication, provide perspective, and inspire resilience. I'm your host, Marcus Engel. With me is the hostess with the mostest, Marvelyne Engel. Hi.
When is that going to be too old to say? I think it's kind of
Never.
outlived its usefulness.
Yeah, maybe so. Oh, well,
Hello, how
here
are
we
you?
are. Hey, so we wanted to talk today a little bit about patient-centeredness. And many of you know that I've been a professor at Notre Dame now for, 6 or 7 years. As an adjunct, I get to go in and help instruct a class that we call the Pathos Project. Pathos translates to suffering. The Pathos Project is not the real name of the class, that's the nickname of the class. The real title of the course is Introduction to Personalism in Medicine. Introduction to Personalism in Medicine. And there's various points and parts to the course, but what we're teaching is patient-centeredness and compassionate presence. And I get to help the students. These are all future medical doctors. Most, I shouldn't say all, there's probably 95% are future docs. Maybe 5% are future nurse practitioners or nurses or pharmacists. But what we're really teaching these students to do is to provide therapeutic presence, how to be with another person during their time of suffering. And that goes right into this idea of being patient-centered, patient-centric. And so we thought we would start with a little definition today. It's not a little definition, it's a very thorough definition of what is patient-centered care. And I'm going to ask Marvelyne to read this so I don't screw up this definition because it's very important.
It is important, and I just have to say this right now. Every time you talk about what you guys teach at Notre Dame with this class, it just gets me right in the heart. The art of being with, just to think about that for a minute, what that really means and how few of us excel at that naturally, and how vital it is for the well-being of another person. So the IOM, or the Institute of Medicine, defines patient-centered care as providing care that is respectful of an individual patient and their preferences, needs, values. So I read it, so I didn't get it too far off. The whole idea that we are looking at a single person, not a group, is really life-changing as a patient when a healthcare professional practices that well.
Sees you as a person, right? A person with preferences. What was it? Preferences, needs, and values. Individual preferences, needs, and
And
values.
right.
And I think we can all relate to that idea of being. I don't think any of us want to be categorized in necessarily. The sociological idea of the in group and the out group would argue differently, that we do want to be in a group. And yet at the same time, we don't want to be completely grouped in where we're thought of with only the dynamics of the organization or only the dynamics of the culture, and not with us as individual human beings with individual preferences, needs, and values. So I've been categorized prior to, well, I don't know, I guess probably all of my life in some way I've been categorized. And we want to kind of steer away from that into the idea that each individual has their preferences, needs, and values, not a group, but individualized care.
Which, I think it ties right into something we hear so frequently from patients and from friends and family members. I didn't feel like the doctor was listening to me. I thought he saw me, decided this thing about me, and just poof, gave me sterile medical care, as if this was the sum total of me. Instead of, and we hear these stories even on the news of how it took so long to get the right diagnosis because the physician or the healthcare team didn't take into account the whole person. And it sounded like I was picking on doctors, and I'm not, because we've all experienced it. If we go to, if we're seen in the medical community very frequently, we've experienced from everyone who, just kind of, basically feel like you're on an assembly line. And that doesn't mean that's what they're doing. They're doing 50,000 other things. But
But it's the
feel
patient's perception of what's going on,
correct.
right?
Yes.
And does that patient perceive that they're being listened to as a unique individual or as just a diagnosis, the sum of their parts, so
Right.
to
Or
speak,
their complaint. They come in with,
or the
you
complaint?
know,
That's
a
absolutely
complaint,
right.
and then you're just the whatever. Um, Instead of, wait, this ties into five other things, and it makes a very different picture than what one single isolated event might be.
Yeah, for sure. We also learned a little bit about patient-centered care from it's the Pickerel Institute.
Yes, picker. I think I want to get that right because that's really
Yeah, let's get that
it's
right.
it's pickers, and they worked with Harvard on a study to help define what a good practice of patient-centered care is. And I'll learn how to talk one day. And it's very all encompassing. It's super amazing, and the work they do to help improve medical well-being of practitioners
Experiences, yeah.
and patients, because obviously the practitioner is a big part of feeling good.
So we actually there are 8 different pillars to this idea of patient-centered care, and we thought that we don't really have time to run through all of them, but we thought there were a few that directly related to some of my experiences as a patient, not only as an 18-year-old, but as a, gosh, I guess a 48-year-old last summer during a major hospitalization. And so let's share just a couple of those pillars that what is good patient-centered care.
Well, the first one is something we've already unpacked a little bit, and I think it's kind of the foundation, which is that you look at the patient as an individual. And I will tell you that when I heard that, the first thing that came to my mind is, okay, so someone comes in and they have a broken foot, and it's basically the same break, all three people. You have to stop and listen. A I'm going to say very elderly person who with a broken foot, their biggest concern may be, am I going to be able to walk and function in my life? Um, the second one, if it's a 30-year-old mom of three toddlers or three kids under five, her concern is, how am I going to do this and let it heal while I keep up with my kids? And then you may have a
17-year-old student athlete who
oh,
is worried
yeah,
if they're going to be able to play the big game
correct.
or be able to practice and even go out and dress out for the
Or an
season.
executive getting
It's
ready to do a big presentation the next day, and he's got to be able to, stand there and deliver, or sit there and deliver, but he's got to show up at work, you know to get it done. So same injury, but very different initial concerns, and none of them are just a broken foot.
Right, right. And how do you know that if you treat every broken foot as the same broken foot? You can't, and that's why we want to get back to this idea of being very patient-centered, not injury-centered, not illness-centered, not gosh, how else would it be?
Room number.
Uh,
So
room number centered, but as an individual, I know that it was the easiest way to sum me up to say car wreck or blind guy, uh, as my most identifiable factors when I was a patient as an 18-year-old kid. However, is that how anybody wants to be seen, right? Do I want to be known as, identified as the car crash, the car wreck? Do I want to be known as that, right? Do I want to be identified with the worst event of my life? I'd say the answer is no. And how do we get around that? Well, we actually have to take time and stop and listen to the patient. Once again, listen to the patient, ask curious questions, and then we start to build up an idea of who is this patient on the whole? Who is this patient as a whole being, not just a single injury, illness, room number, prognosis, diagnosis?
Correct. And that works really good in everyday life too, with your spouse, with your kids, to just stop and go, wait a minute, this is a person, and I'm going to interact with them as a person, not just whatever it is, the sales girl, or, whatever it is, the banker. I'm going to remember this is a real life person. And if they're grumpy, I don't know what's happening in their life behind the scenes. So it's a universal truth that every person we meet is an individual. They have their own hopes and dreams, and they're struggling with their own stuff. So,
Just like we all are.
taking that moment to listen when it's appropriate, um, is vital for relationships and for the kindness of our world.
Yeah. What was our next pillar?
The second pillar that I connected to you immediately when I read this one was really because in the editing of your first book after this, which is your memoir, um, this is something that you specifically talked about the value of, and it was understand the principle is understand the importance of the family and friends around the patient, the person in the bed.
Yeah.
So
Yeah.
talk a little bit
Gosh,
about how that was as an 18-year-old kid.
boy, I needed human beings like I needed oxygen. I needed human contact. I needed my high school friends, my college friends. I needed the residents of the small town where I grew up. I needed my mom and dad. I needed my sister. I needed my family members around me. And when I witnessed that healthcare professionals were taking care of my family and friends, it felt as almost they were taking care of me too, even though um, whatever may have been going on was directed at a family member or a friend. It felt like they were taking care of me. I want to know, of course, I love my family and friends. I want to know that they're being treated right as well. And I specifically think of a story of my three best friends from high school who drove in the middle of the night, some 2 or 3 hours away, to come visit me in the hospital. Well, they show up. I say it's the middle of the night. It was late evening, and they show up just before it is the end of visiting hours. And gosh, I had waited for this visit for days and days on end. I was so excited to see my buddies again, to have some time with them, to learn what was going on out in the quote unquote real world outside of these four hospital walls. And yet, when visiting hours, the time came for visiting hours to end, they were told by a nurse that, hey, it's visiting hours are over now. You guys need to go. And I was the one who protested and said, why do they have to go? Can't we just close the door and, not be loud? Why did they have to go? And thankfully, that nurse was very lenient and knew that my friends and I needed that time together. And I just believe so much that when we take care of friends and family, we are also taking care of the patients.
We are. And I know some hospitals and, you know, times have had time. There's been times when hard no's were hard no's and they needed to be, this is the rule. This is what we're doing. We didn't make those. And it was beyond a healthcare bedside person. They couldn't change the rule. But when you can and when it's appropriate, especially, I always, when I hear that story, and I remember when you first told me it, and I was reading your first writing of it, how to an 18-year-old, kids their friends are life. How many yearbooks have you seen where it was, I don't know how I would have survived my life without you? And you're going, you were 17, you haven't even begun to survive life yet. But we
Boy, but
we
at that
but
time,
we feel that way, right? We
mhm,
feel like, oh my God, this is everything. And when you had a caregiver who was willing to go, okay, but just shh, and you and your friends were super respectful, you didn't disturb anyone, and you got a little more time to just be a dude, hanging out
mhm.
with people that he loves. Um, that was life. And mentality is such a big part of health and healing.
And we get to that pillar of patient centered care by including friends and family,
Yes,
right?
we do. And that accidentally rolls into the last pillar that we're going to talk about, which is how to comfort a patient and help with their anxiety and help with their fear, because they have shown that in some cases, the fear of what's happening to them, because they don't understand, they're not medically savvy, or they just haven't been exposed to whatever it is going on in their body, the fear and the stress of that takes a worse toll on their health than the actual medical event.
Yeah. That's, I think, common, really. I think you go into, somebody goes into the ER because of an injury or an illness, and their first thought isn't about their injury or illness. It's, oh my gosh, what do I have to take care of at home? How am I going to do this with this? Go back to the example of a broken foot. How am I going to work? How am I going to chase after my kids? How am I going to get to practice tomorrow? How am I going to be able to get around by myself? These are all those questions that start flooding along with the injury or illness.
Correct.
And boy, the other one that I think is such a big fear when somebody goes into the hospital like this unexpectedly is financial anxiety.
Oh,
How much is
yeah.
this going to cost me?
Yes.
How much is this going to cost? And I think that hospitals have done a pretty good job of bringing in the financial piece very early on and hopefully alleviating some patient anxiety by getting some of those discussions out of the way early.
Yes, I think that's a crucial piece. And we know that it seems like every day there's a illness, and maybe you know the generic name, but you don't know the technical name. And it sounds like, oh my gosh, I've never heard of that. How horrible is it? How scary is it? And then it's really not this monster you made up in your mind, because the technical names sound so overwhelming. And maybe the patient is good at speaking up and saying, wait, what is that exactly? And what does it mean for my future? Or maybe they don't. Maybe they just sit in that fear and anxiety because they're timid, or they're just deer in the headlights, frozen kind of reaction. So they spend hours, and often they don't have their phone or they don't have internet, going, okay, I'm going to pass away within 2 weeks now. And then it's a fancy name for hangnail. I mean, not quite that extreme, but we fear the unknown. So taking a minute to listen and say, do you know what that is? Or, you know, I want to assure you that this by itself, obviously you can't make guarantees of promises you can't keep. But when you can alleviate concern, do it. And I'm going to ask you to please tell a story about that was more recent when someone helped you with that. Do you know what I'm talking about?
Wow, there's a few there's a few stories that come to mind. I I can think about, well, a little more recent, that 10 or 12 years ago, I was very, very sick in the hospital. And some of the nourishment that I was receiving included insulin. And as it was being explained to me what this concoction was, they said there's insulin in there too. And I remember feeling like the world had just fallen out from under me, and that because I was receiving insulin, I was diabetic. And
I remember that.
I remember not saying, I don't want to be a diabetic. I don't want to have diabetes. No. And it took a lot of assurance and a lot of assuaging of my
It took a
anxiety to
lot.
convince me that I was not diabetic, that this was just a short term medical fix for a problem. It, there's lots of times like that when a patient can improperly hear something or improperly evaluate what they heard. And next thing you know, they feel like they've got a terminal disease that might leave them underground within 24 hours. And yet it's really not a significant illness. And with a little medication, it'll clear right up.
And even if it is a significant illness, it's still better to know for most people and explain a
Absolutely.
plan of action. Or our doctors are great with working with this, manage up some there. And people, it's not knowing that is usually the hardest. And I my heart goes out to those of you who do have to deliver bad news. That would be a very difficult thing. And I want to remind you to have grace and take care of yourself if you're in that position frequently. But that's still not the story I want you to tell. It
Which is the story you want me to tell?
happened about a year ago.
Oh, well, I definitely remember being bit by the snake, obviously. When that cottonmouth first got his fangs in me, I could feel the venom moving into my hand, and I could feel my hand beginning to swell. And that was while he still had his fangs in me. A couple of minutes later, washing my hand in the sink, I was trying to get the venom off of my hand, and my hand is swelling up bigger and bigger and bigger. And obviously, I cannot see my own hand, but I can feel it with my opposite hand. And as it's getting bigger and bigger, I'm sitting there thinking, where does this stop? Where does this stop? Once they had me loaded into the ambulance, the EMT who was with me in the back, my hand had gotten so big it was spreading down to my wrist and into my forearm, and I'm keeping it way up above my head, keeping it elevated. And I remember asking the EMT, "Is my hand going to swell up so big that it explodes, that it splits open?" And he said, "No, that's not going to happen. That's not going to happen." I told him I didn't believe him, but he was right.
That's the
It did
husband I
not
love.
happen.
I don't believe you.
It did not. I don't believe you. But nonetheless, he was actually right. And due to the fact that we got into surgery so quickly, no, my hand never did uh, explode or tear apart due to the
And
swelling.
how would we not know? It seemed like the swelling was never going to stop.
Going to stop.
But
Yeah.
but I always laugh when I hear that, and I know you don't tell it super often, but I always smile at now, not at the time, that something's happening. You don't know what it is. You're not experienced with it. We weren't. I wasn't in the ambulance with you though. And you wouldn't have believed me anyway. But you're asking for a bit of comfort. And here that you are flying down the highway, lights and sirens, everything's going off, and you're worried your hand and your skin are going to explode. And I would have been worried about that too. When is it, how does this end? And he still was kind enough to be very assuring. No, that's not going to. He accepted your, I don't believe you, with grace. And he offered you the most comfort you could get in that incredibly painful and unknown time. Um, and so that makes me smile. It makes me want to find him and give him a hug for being so kind to you. Um, Dear
But it goes back to just being one of the many aspects of this idea of patient-centered care. And we're just really glad that we could bring you some of these pillars of patient-centered care, give you a definition, and maybe a couple of stories that go along with what it really means to be centered around that human being that is in the bed, in the hospital, or in the clinic. Uh, we're just really glad you took the time to listen to us today. So thank you for that. Thank you, Marvelyne, for all of your input and help with this. And
Thank
thank you, listeners, for being part of this episode of Compassion and Courage. Please visit marcusengel.com for your keynote speaking needs or healthcare consulting, books, presentations, etc. I want to thank you so much for being part of this episode of Compassion and Courage.
Thank you, and thanks for all you do.